All right, welcome to the SNF Consolidated Billing question and answer session. I'm Tom Ryan and I'll be your presenter today. I'm joined by Aline Ziegler and she's going to work on the back end and that's the chat area. She's from my team, so she does have information available to you. She may answer your question directly or she may hold it until the end when we present them live. This webinar is for information for fee-for-service Medicare, which is also known as traditional Medicare or Part A and B Medicare. My goal is to meet the needs of everyone asking pre-submitted questions, which were done during registration, and then go through the open questions. The reason that I'm telling you that it is for fee-for-service Medicare right away is that a few of you asked questions about Medicare Advantage plans and them following the same rules. I cannot comment on Medicare Advantage plans. We do not work for them and CMS prohibits us for educating. Each plan is a unique contract, unlike traditional fee-for-service Medicare. So please ask your questions directly to the different Advantage plans. It is important that you get their information from them depending on the plan and all of that. So that's the first questions already set, the first set of questions answered before we even really got going too far. Little housekeeping for you today. This presentation is available to download in our training center. Our training center is available on our website. So keep in mind that that is important for you to be able to get if you want it. It is available in the live events page, and you can then grab that today. It will be removed either later out this afternoon or maybe tomorrow morning, right in that range. But we will put it back up when we put the Encore up. The Encore presentation is put into a different page and it actually has a YouTube player where we will load it to YouTube. But then when you go to that page, you can download the training material. I do want to just kind of show everyone that because I did have a couple people ask me about that information, so I don't want to skip the really basic people. We'll let you know for anyone that is listening, we had some very basic questions because we have some people that are on that are very, very new to Medicare. So I don't want to miss them and I want to make sure they know where they're going and what they're doing. So this is our website. It is wpsgha.com. And what I'm talking about is once you're on the website, you will be asked to select a jurisdiction, which is a line of business. So feel free to do that. Then go to the training center. Once you're inside the training center, you will have these cards down here on the bottom in the body. The first card on the left on the first row is live events. That is where we're at today. And you can see here's the webinar material, which is the PowerPoint presentation for this. So should you want this PowerPoint presentation, it is available. Now remember, later today or tomorrow morning, this will be removed from the website. Then what you must do is go back to the training center and wait for us to unload it in the Encore presentations. We typically do our uploads on Mondays, which is the first business day of the week, sometimes Tuesdays if that's the first business day. And then what we do is we come down in and we say, okay, open it up. Here's your player, but here's where that material will be again. Okay. So I wanted everyone to be aware of it because I did have a few people ask questions and I don't want to lose anybody right at the beginning. So again, Alina's going to put some links in the chat for you that will help you out, including the email if you have questions or you can't get information, and the page for live events. Want to remind everybody that I will take any questions that you have in the chat. We are going to ask that you put them in throughout the event, and then when we get to the end, we'll answer them live. I will get through all the pre-submitted questions. So if you did take the opportunity to send a question in your registration, that is going to be my priority. Okay. Also want to remind everyone, we're going to give you a survey at the end, and it's just really about how WPS is doing overall in this educational event. And then it also gathers the suggestions you have for future education. Again, we'll give that to you as an opportunity at the end, and we'll talk more about that. Couple of reminders. This material that is put together is just an education tool. The rules, laws, and regulations of Medicare do change, so we want to make sure you're aware of where to find them, and that's the last point on here. It's the CMS website. That is the official provider site. It is also the official federal site. CMS.gov is that website. We use it all the time as well, so all of our official information is the same as yours. Now, someone did ask, what is the WPS website? It is guidance from your contractor to supplement the CMS website. We can't counter it. We aren't trying to change it. We're actually trying to help you through a little bit further. The guidance works with the claims processing system, which is why we offer it. Couple of things to keep in mind. I had some questions that were asked that will change based on the information given within the question. So the answer might not be the same if you even changed a minute detail. There was a couple of those that I just wanted people to be aware of. And so when I give you the answer, I can only answer the question that you asked me directly, the verbiage that's there. If you want it different or you want to change it up a little bit, I will need you to put that back in chat. CMS does prohibit anyone from recording this. We are recording it for you. So we will post the encore presentation to our YouTube channel, and then you'll have that available to you on our website as well. But I want to remind everyone that if you're recording it, you need to stop. That includes screenshots, that includes AI assistants that do screenshots, any of those types of things. We cannot control how you use that product, and because CMS does not allow our recordings to be used for any kind of profit-making purpose, we just don't want you to record it so that there can be no trouble in the future. So that's our disclaimers and our information we have. Oops, whoa, my mouse went a little crazy there. Well, know what's going on. Let's get started here. So today, again, we're going to do some coverage basics, and that's SNF Consolidated Billing Basics. The reason that I built that in is some of the questions that came in were very basic, and some of you needed to start way back at the beginning. And so we're going to do that. I do want to do a website demonstration and show you where to locate the files. Now, I built that in as a separate section because I want to make sure that the basic questions are answered before we jump to the files so that we're not confusing anyone and I don't lose anyone. But I also want to make sure I do get to your questions. So I will try to wrap it all up and leave a good amount of time at the end because this is supposed to be a question and answer session. But in order to answer some of the questions, we do have to start back at the basics. So to kind of give you an idea, oh, I'm sorry, I forgot this. We will be using CPT codes. The files on the CMS website use CPT codes. Also during this training, CPT codes may be used for examples. Now, these are procedure codes that are written by the AMA. So by staying on this webinar, you agree to the copyright notice that's currently on the screen. Please keep in mind it doesn't apply to HCPCS codes. HCPCS codes are separately written and those are health. So the two types of codes that we're going to use for this, HCPCS and CPT codes. All right. So to jump to the basics, which are going to be our starting point, there was two main questions that were asked. And one of them was, I just don't understand it. Well, I'm going to guess that means that you don't understand SNF Consolidated Billing as an overall. The other two was, I just want to have a better understanding of the basics. And then in conjunction with that, just give me some basic information. So I just don't understand it. I'm hoping that I'm going to meet your need here. And the other two, the ones that were asking for the basic information, what we decided to do was to build a basic summary in. That's what this first part is. It's that basic summary to try to make sure I don't lose anyone who is new. I did have some people just comment that they were new in general and they were just looking to get started. So I want to make sure I have that for you. So what is SNF Consolidated Billing, otherwise known as SNF CB? This is a form of bundling that says that the skilled nursing facility is responsible for most care provided to patients while they are inpatient in a Medicare Part A stay. In other words, the SNF that has the patient inpatient in a medically necessary stay must coordinate the patient's care and then be reimbursed for that care. During the coordination, they must in turn reimburse the external providers providing the care. But part of that bundling says, hold on, we're not quite done yet, because it wouldn't be, that would be amazing if it was that easy. Instead, what the bundling goes on to say is, unless it's beyond the scope of a SNF, in other words, it's not possible for a SNF to do that. And that's where some of the confusion comes in. So we'll talk about that in just a little bit, okay? So I want everyone just to be aware of where it's coming from, what it is, but it's really a form of bundling. It's really a form of creating a overlap, if you will, which means that the Part A stay takes precedence over the other services that are performed, of course, unless it's on that exclusion list. Now, the exclusion list will be the second part of this webinar where I actually demonstrate the website. So what are the stays and why is this important? First, there are two types of stays for a skilled nursing facility. The first one is what is called a Part A stay. This means that Medicare is paying the inpatient care and the nursing care. Okay, that's the inpatient part, so the Part A stay. They being the patient will get 100 days of skilled nursing care if they still maintain a medically necessary stay after that, meaning the 100 days are paid, we're not going to pay any more Part A inpatient benefits, then we would term a Part B stay, which simply means we'll pay for anything we would pay on an outpatient care basis. So the benefits are exhausted. A Part B stay also says you didn't meet the basic Medicare coverage criteria for Part A stays to kick in. So it's a coverage exclusion or a coverage criteria issue. So let's talk a little bit more about what that means. So a Part A stay begins after a 3-day hospital qualifying stay. A 3-day hospital qualifying stay means that it has to be a day of admission is day one. Next is a full day, then a third full day. Then there is a day of discharge, but because Medicare doesn't pay for that, that's not part of the 3-day qualifying stay. So some people like to use the term 3 midnight census, where they're actually counting, hey, were they in at midnight, were they in? And that's what Medicare is looking for. Medicare also goes on to say that part of that coverage criteria is that a patient must be admitted to the SNF within 30 days of the hospital discharge. So those are all the technical criteria that you might want to be aware of. I just want people to kind of get aware of that. Now, there are some exceptions to the 30-day discharge, like it's planned that you will be out for 45 days or 50 days or whatever. So we're not going to get into all of that. And if you want to learn more about that, go ahead and attend the SNF billing classes, and which is actual skilled nursing facility billing classes and other things like that. During that part, what you must be aware of is that Medicare says you get 100 days. Once the 100 days are within the SNF, right? You no longer get a payment. We're done. So if you didn't meet the qualifying, you won't get a payment, or if you stayed in for 100 days. Now, it's not 100 consecutive days. It's not 100 calendar days. It's 100 benefit days. So for a benefit day, if you want to think of it this way, it means that Medicare Part A is paying. So that means, how does that work? You can have a lapse in stays. You're not inpatient at that point, right? Let me give you an example of this. The patient goes in a hospital, is in for 5 days following a fall, then transfers to the SNF for rehabilitation for the broken hip. They spend 35 days in the SNF. Everything looks good. They're discharged and headed home. They are at home for 14 days before they burn themselves and head back into the hospital. During that hospital stay, because of the burn and the location of the burn, they now need to go back to the SNF to continue rehab because it was located next to the hip replacement, which then stopped some of the physical therapy during the treatment for the burn. So all of a sudden, we haven't had any lapse there. Okay. Things to keep in mind, the 60-day, or the inpatient care, the hospital acute care does count both their regular hospital days, which is deductible and full pay days, and their 100 lifetime reserve days. Lifetime reserve days, though, which is a term used for hospital stays, not skilled nursing facility. There's no additional days. Okay, it's not 100 plus. Lifetime reserve days are used for a hospital. So hopefully we got all of that. So those are our basic 2 types of stays. Remember, medically necessary, both. Part A stay means Medicare Part A, the inpatient is covering. Medicare Part B stay just means, hey, the inpatient days are expired. We're over that 100 and we haven't started a 60-day lapse, or we haven't completed a 60-day lapse to start a new benefit period. I did receive a question on SNF billing, and so I thought I would build this in the basic information. Hopefully it helps answer that question. The question is, do the SNFs bill the exact same as we do? Now, this person was submitting on a 1500 claim form or 837P. It's during the registration process we asked you that. And so the answer is no, they do not. Remember, SNFs do not send claims on a daily basis. So just because the service is done that day doesn't mean tomorrow they're billing for it. They're under a prospective payment system, which means all of their stuff must be put in together, and their stuff is every service provided, including the external stuff they are responsible for paying, or the external services they're responsible for paying. They then send monthly claims. Each monthly claim is a continuation until the patient discharges, and they will continue to send monthly claims even if there is no payment to be made, and they're called no pay claims. But keep in mind, when the SNFs bill, the claim must process before the next claim can go in, before the next claim can go in. So if something happens with the first claim, there's a lapse in time. And I think that is what the person was asking us, because after the chronological order comes in, and let's say that there was a break in the first one, they've sent in 4 or 5 claims, and all of a sudden 60 days later, they're getting money taken back saying you should have billed the SNF. This is the scenario. Well, because the SNF bills in 30-day increments and it got stuck, they billed it 15 days after discharge, which is really about 45 days for that first month. Okay, then it got stuck, it didn't process right away. Then when it processed out, it was later. We are given an automatic feed saying, oh, wait, hold on, there's now inpatient Part A stay, which would apply for the bundling service. So now these providers that build these services now need to bill back to the skilled nursing facility. So it gets a little confusing, but hopefully I answered that question well enough. And I hopefully that explained why sometimes you get overpayments that you may not be expecting. Okay. One thing to keep in mind is that SNF reimbursement is not the same. They are not paid on a fee schedule reimbursement, which goes with a previous question. SNFs are reimbursed under a prospective payment system. A prospective payment system uses a variety of factors to figure it out. So SNFs can be reimbursed for Part A stays, and that's the prospective payment system. Once the Part A stay is done, or there are certain services such as preventive care that is always reimbursed as a Part B, then those services are done under the respective payment system or payment methodology for that. Could be the physician fee schedule, could be a lab service, could be any of those types of things that would be billable under Part B, and that's where we talk about the different fee schedules and other things applying. So the basics are SNFs will always start under the Part A prospective payment system. That's their main reimbursement. That's what causes the bundling. When they move to the Part B services or the Part B stay, then they're reimbursed just like you would be under a fee schedule reimbursement basis. So hopefully all of that makes sense. This is a slide I like to put in. It's called excluded services. And the reason that I put it in is to highlight that there's a couple of different things going on. And a lot of people get confused over the terminology as I teach the class. So I just want to be clear. First, there are 2 types of excluded services. One you're probably familiar with, and it's called Medicare excluded services. Medicare is never going to pay for that because a law said no, or it's not part of the Medicare benefit package. It's never going to be part of the Medicare benefit package. Even if you argue that it's medically necessary and can prove that it's medically necessary, it's still not payable. The law said no. This is different than SNF Consolidated Billing excluded services. What that means is that you bill those services directly to Medicare. So it's SNF Consolidated Billing excluded services. They're not part of the bundle. The SNF cannot be expected to provide those services. They don't normally have that ability. And so with that said, when we talk about excluded services during this class, I want you to keep in mind I'm going to use the second term, SNF Consolidated Billing excluded services. The only time that I will use excluded services and reference Medicare excluded services is when I specify the word Medicare. Otherwise, it's just going to be SNF Consolidated Billing excluded services. That's important on the next section, because in the next section is where we're actually going to get into those files, and we're going to see a bunch of different files. Okay, so hopefully that's okay with everyone, and everyone has a basic understanding. I'm going to encourage you at this point to put your questions back into chat, and we'll get those answered in just a little while, but hopefully I got all of your base questions answered and we got enough information there. Okay. So the one question I do want to make sure I addressed is coming from the website and why we're going to the website and why we're looking at that is, my patient is in a Part A bed. What can be billed to the skilled nursing facility and what can we bill to Medicare? So they're in a Part A bed. That tells me that in a skilled nursing facility that they're in a medically necessary stay. Here's the thing to remember with that though. Can you tell me if the 100 days has lapsed? Let's start there. If it has, then you're going to bill directly to Medicare for the most part, and I'll explain that in just a moment. If it has not, then you're going to go to the website and you're going to look at these files on the website. Okay. The other thing to remember is it a Medicare excluded services? Because that is always billed to the patient. Okay. Now a SNF consolidated billing excluded service, that's billed in Medicare. So let's get through these files and so I can show you a little bit about it. A couple of things I want to do before I move to the website is just, show you what you're going to find and a couple of basic things you'll need with these files. Okay. So again, they're used to determine if you bill the SNF or Medicare when it is a medically necessary Part A inpatient stay. Why do we keep saying Part A? Because again, they have to be under the Part A benefits. It does contain procedure codes. The procedure codes are in different files, and there are 5 of them. One of them has got major categories or even breaks down further. That is an Excel file. The other 4 are also Excel files, but in a different section, so there's a bunch of files. They do require you to have unzipped software, which is available to download from CMS if you don't have this on your computer. The software the zipping just compresses the file so that they actually can store and be downloaded faster and easier for you. These files are updated annually. So the file itself is updated annually. However, CMS does publish updates between the annual updates on their website. So you do need to look at that. That became a question that I wanted to answer because someone asked, where do I find the updates? Do they ever update these files? And the answer is, remember, updated annually, but in the in-between time, check the website. And we're going to get into that in just a couple of minutes here. With that said, I'm going to go ahead and move on to the next slide and say, hey, this is where I'm going to show you the website. I'm going to stop using the PowerPoint for just a little bit, and I'm going to go to the website because I think it's actually better for you to see the website and to see this live. So we're going to go to cms.gov. This is the CMS website. Now you can type SNF CB, you can type consolidated billing files, whatever you want to do. I'm going to give you the navigation path. So it's Medicare. Then we look at all of this and we're like, what do we pick? Okay. I want you to pick coding and billing because that's what we're talking about. Consolidated billing. Slide over into the other side. That's going to open up the blue body. And then if you go all the way to the right column, second one down is the SNF consolidated billing information. This will open up the web page on the CMS website that contains the files, but it also gives you kind of a nice overview. I'm just going to scroll down for a second. And you can see here's the Part A files and here's the Part B files. I will define those for you in a second, so don't get hung up on those. But down here on the bottom, we do have some different links that you might be interested in. One is consolidated billing. So it kind of walks you through finding different things. I may reference this a little bit later, depending on the questions that we get in, but I wanted you to at least have seen these 2 links. All right, so let's talk briefly. I'm trying to get back up so I can have the 2025. Let me shrink this down a little bit. Hopefully I'll be able to get the 2025 files on there for you. Okay, so the 2025 MAC Part B update and the 2025 MAC Part A update. The Part B is about different Part B services that are billed directly to Medicare. The MAC Part A update is about the services the SNF is responsible for. So we're going to take a look at this one and we'll talk about that. Then we'll move on up to this one and we'll talk about that next. So this is where I talked about one Excel file that's got different categories within it. And the Excel file is available for download. But as you can see, here are the updates that have occurred to this file. And some of them are 2025, some of them go back, here's a 2013 update, which now has been incorporated into the file, but it's just so that you are aware of what you're looking for. So do take a look at these different updates and timeframes and all of that. We're going to scroll down to the bottom. And here's a couple of things I want you to be aware of. First, the file is the top one. The second one right here is just a PDF document. I say just, not meaning it's unimportant. It is actually very important. This PDF document explains the file, but then talks about each major category and the exclusions and inclusions within that category. So here's the major category 1, which is very important because this is when they're in that Part A stay, they're inpatient. And it says, these services must be provided on an outpatient basis at a hospital, including a critical access hospital. Why is that important? Because when you come into the major category and then you go into the further breakdown, which is the sub areas underneath it, things like a CT scanner in here, an MRI. Can these be done in other service locations other than a hospital? And the answer is yes. But if they are, then they're part of the SNF bill, which means you as an external provider must bill the SNF. The SNF must bill it in, you must pay. If they, on the other hand, are done in a hospital or critical access hospital, then they are not part of it. So lots of different things going on there. I do want everyone to be aware of this statement right here, because this one throws people off. This is about major category G and its services performed in an emergency room. If these services are not billed with a revenue code 045X, so 45X is what you're going to commonly hear this referred to, they are automatically included because they were not billed as emergency room services, even though they were performed there. So inappropriate billing can also cause bundling. Lots of stuff going on there, okay? So as you read through it, you'll be able to see all the different major categories and go through all the different files there. And I'm gonna let you read that on your own. But I wanna remind everyone that this is your downloadable file. This is your zipped file. So we're gonna go ahead and select that. We're gonna just go ahead and download that onto my desktop real quick. And what's nice about this particular zipped file is that it is broken out in Excel, so it makes it very easy for us to look at. This is what it looks like. Okay, and you can read the file in here. They're the same file. One is just a comma separated and one is an Excel file. I'm going to use the Excel one because it's easier for me. As this opens, keep in mind, there are major categories, and then the major categories can have different things underneath them, and different things are sections. And so that's what we're looking for here. Do we have all of the information that we need? So here you can see, here's the CPT code or the HCPCS code, right? That procedure code that we need. Then we move to a short descriptor, but this is the important one. This tells us which major category it falls into. And then if we scroll down further, you will see major category, and I want to say it's F. And it's going to tell us it's a surgery, so therefore it's included, because these are the surgeries or the surgical procedure codes that a SNF is able to do. Sorry, I just got to get down to it, y'all. You can welcome, so you can see here, it says the word inclusion. You are welcome to, if you want to filter for something or you want to use find, whatever you want to do here. So if you're looking for a specific procedure code, do your data and your filter on the top, and then you can just filter it in and type the procedure code. It makes it a lot easier versus just trying to scroll through something. If you're not, again, sure what the caveat is with each major category, then go back to that document that we looked at earlier and check that out. All right, so that's one of the two files. The other one is a bit more broken out because it is the Part B files, and there's a variety of different files within it, and there are 4 to be exact. So we're going to go ahead and leave the Part A files, which were down here and we just talked about. We're going to move to the Part B files. And again, read through the Part B file, add to file 1, etc. Delete from file 1, file 2, etc. And then you just kind of keep going down and you'll come to the different files. Each file does define for you, and I'm not going to open each one, but each file does define for you information that must be billed to Medicare. So for instance, This is physician services. Well, it's not part of the facility charge, therefore these get billed to Medicare. This is professional components that need to be billed. This file is interesting, and I'm just going to open it for a second, having had the other one open as well, because when you look at this, some services that are on here will need to be split billed. So all services on here, but some services on the other one will need to be billed. That is important to understand, because if you don't split bill these, if you do not split bill these, if you leave them the same and you bill the SNF, they can deny it, right? But if you leave them and bill us, we can deny it. Did everyone know that? Because you didn't split bill it. And in this file too, it's telling you, you bill this component with a modifier 26 to Medicare, you bill this component with a modifier TC to the SNF. It's explained right here on the top, but you can see there's all kinds of different components and files that you want to look up. Okay. Now, as you go through, you're going to find a slide that is going to say, hey, what happens if it's on both files or not on both? I'm going to use, I'm just going to use Control Find, and I'm going to put a procedure code in here. The one that I'm choosing to use is 70540. So this one is on here, and this says this must be split billed. In other words, it is an MRI, but when you do the MRI, the professional component goes to Medicare. The skilled nursing facility gets the technical component, which is a TC modifier. If you don't do that, neither one of us are paying it because it's not billed correctly. So, so again, let's jump back out to this file. Do the same thing. Let's sort on the HCPCS code. Let's and find that. And so you'll see it here saying, yeah, this does need to be billed to the skilled nursing facility, but that's where you have to use both files in conjunction. So hopefully that makes sense and answers those types of questions that I did get in. I'm going to jump back to my PowerPoint at this point because we are at that point where we've gone through all of these different demonstrations. We did explain this. We did these two interpretation file twos. This is the exact example I just gave you. Which brings us to the question and answers. What I want to let you know is the next few questions are your pre-submitted questions. And then we will again get back into those questions that you've got in the chat for me, okay? So what resources are available to provide a SNF to explain the consolidated billing process for facilities who are not familiar with consolidating process? So I gave you some different website stuff, but I also want to show you another resource too. And I mentioned it pretty briefly, but it's going to be back on this consolidated billing area here. And down at the bottom, if you go to consolidated billing here, this is a resource page that just gives you a lot of the background information, where this law is furnished, all of this types of things. It's got a lot of really good information that can help you. It's got different reports, effective dates, all kinds of stuff that I think will be good for you. It does also talk about a different section of the Social Security Act, which I do think you should be aware of, that says physical, occupational, and speech language pathology services are always subject to consolidated billing. I will tell you that is regardless of a Part A or B stay. When they say always, they mean always. The skilled nursing facility is the only one who can bill those services. So it is something that is regardless of professional, anything like that, it has to go to the SNF. It's what the patient is in there for. You can bill the SNF and they are responsible for paying for that. What I do like about this, again, it does talk a lot about some of the different things that happen. It does have this historical questionnaire, which is great for referencing, but it also has this best practice guideline. That's why it took me a long time to get to the bottom, right? Once I hit the bottom part of it, I get to this best practices, this will talk about the different agreements that are here and notices that may help you. This may help you when you explain to a SNF. Now, these are ones the SNF would typically send to the provider, but because the SNF sends them, it does explain who's responsible for what types of things. So these are just great resources to kind of help the SNF out. Hopefully that will help you. Here's the claims processing instructions and all the different types of things you might need to know. So those are my biggest resources to help you. Hopefully all of that will get you through what you need. Next question. How do we know if a patient is registered inpatient or outpatient in a hospital when they're coming in for a SNF stay, rehab facility, or nursing home to be seen? Inpatient or outpatient hospital really isn't going to affect the SNF in terms of payment wise. Now, they can't be in both. They can't be in a skilled nursing facility and a hospital. They're one or the other. So you may have to ask them. Remember, the billing situation is something that you have to be aware of, because yes, there are indicators within our portal, our secure net access portal, that can help you, and I'll show you those in just a moment, but those are only as good as the information put into the claims processing system. So if we don't have that information available, it's not going to be there for you. So I wanted everyone to kind of be aware of that, just, understand where that's coming from. So let me give you a little bit of information here on our portal. Now, our portal is available on our website. It's wpsgha.com, and it's the secure section. I can't log in because it does have PHI and PII, so this isn't going to help you guys. So let's go to the portal user manual. We're going to scroll down just a little bit inside here. We're going to find all the different functions and the items that are available. What I like to do is tell people, come to the eligibility information. Seems a little bit weird, but within the eligibility information, if you scroll down, you're going to see some fields that may or may not help you. First of all, the summary field itself will provide you with a bunch of entitlement dates and other things like that. But I want you to move to the Part A deductible. That field, again, it says Part A deductible right on it. It actually tells you, are they in a Part A deductible base? This would be your hospital base. Are they in a skilled nursing facility? How many earliest days remaining? What's the deductible? All of that type of thing. This is right here for you. So hopefully that makes sense. Jumping back. Correct billing and reimbursement. Not really sure where to go with this one, and here's why. Correct billing to Medicare doesn't change. If it is something that's billable to Medicare, follow the Medicare guidelines for billing. Okay. Medicare reimbursement is based on the fee schedule, should Medicare be reimbursing, or the payment methodology that is affected underneath that. So if it's an outpatient hospital setting, we use OPS, outpatient prospective payment system methodology. Any of those types of things could apply, okay? However, if it's the skilled nursing facility, we don't control their billing or their reimbursement. They have to get what they need. So keep that in mind. The skilled nursing facility may ask you to bill certain key pieces of information. It's because they need it on their claim. They may reimburse you differently. That is all worked out in a contract between you and them. What we can say is, if there is no contract, you can expect to be reimbursed up to what you bill or what you've agreed to, settlement on a claim-by-claim basis. So we can't really offer you a whole lot more. If you don't feel like you're being reimbursed and you should be reimbursed, then you do need to take what you would do for any other debt, anything that's owed to you, and take whatever legal action that is, which could mean consulting an attorney, which could mean consulting your legal counsel, which could mean, whatever that happens to be. So it is a little bit different when you're talking about what Medicare pays versus what a skilled nursing facility pays. Let's go on. What course of action does a provider have when billing a SNF and they refuse to pay? It's kind of funny that I just answered this question without actually intending to, but please remember the course of action is that whatever illegal action you would take for a debt that is owed to you. So if a patient owes you a debt, what would you do? If a vendor owes you something because they didn't pay you for something they came and got, what would you do? It's the same action here. They owe you a debt. Okay. So we don't have that answer for you because we don't know what your business practices are there. What to do to get a SNF to pay our claims when our patients are in their facility and undergoing chemotherapy treatment. Most SNFs don't respond to calls or email when they try to get them to sign the payment contract, which delays patient care. This is something that is not something Medicare or even your MAC can be involved in, because again, this is up to the SNF and you to work out. One of the things is that if you have one skilled nursing facility that you work with on a regular basis, or maybe a couple of them, you can do contracts that aren't patient specific. They're general in nature and say, if we have this patient and they come to you, this is what you're going to pay us. We're going to file to you within this time frame and you're going to pay us within this time frame. If not, here's the penalty for us, here's the penalty for you. All of that can be spelled out in advance. Now, if it's not that case and they aren't paying you, again, this is a legal counsel question between you and the skilled nursing facility. It's not something we can get involved with. Again, I did show you that best practices guideline, a lot of information on that. And both of the two websites, the actual one that talks about, hey, which procedure code should go to the SNF, and the second one, which is just on SNF Consolidated Billing in general. Check out the information CMS has to offer you there, but I will tell you it's very generic information because we are not directly involved in that process. A couple people did ask me how to better communicate with the skilled nursing facilities. Now, I say a couple people, that's not the exact question. I understand that. It's my summary of kind of putting it all together. I will tell you, start with the best practices guidelines. Try to follow them. Start by establishing within your own organization, which SNFs do you commonly work with? If you have a list of ones that you commonly work with or that you commonly have patients in, the best way to do it is to open that communication line on a monthly basis, maybe, or whatever they need. Could be weekly basis, whatever works best for you in the skilled nursing facility, so that you have that communication going back and forth to make sure everything is being billed correctly. So when we talk about the best way to do it, each provider, or some providers, have been very inventive. We actually had a provider tell us that with their practice, now this provider is a physician's office, but within that physician's office, they have a lab and some other equipment, which could have to be billed back to the skilled nursing facility. And what they've done is identified the most common skilled nursing facilities they work with. In this case, there was 5. And what they do is basically send a monthly thing saying, this is who we saw for Medicare, are any of these your patients? And before they bill us, they get a response back from that. That's one way to do it. We can't really tell you or define for you the best practice, but that's one way to do it. Another one, they have an electronic portal that they use. Don't know much about it. They just have it. They were telling us about it. Again, we're not involved in that process, so we can't really offer you much more legal advice or much more advice than that. All right, I did have one more pre-submitted question before I open up for live questions. This one did not get a slide built. It came in after I had the slide deck built because we needed it ready to get published to the website. So if a provider didn't enroll until this year, how far back can it retro enroll? Is there a penalty? Is a biller how we can get reimbursed if the provider isn't enrolled in PICOs? Okay, so let me first quid pro quo this and say this is a facility. I know that because they bill on a UB04 or an 837I institutional transaction. This means that this question came from a facility. It is not the same answer as someone who is not a facility. So for a facility, we do not retroactively enroll. What we need to do is to get you enrolled moving forward. Now, with that said, sometimes CMS, which by the way is part of the process, you send it into us, we look at everything, you have to have an inspection done and all of that. CMS may say, hey, you started your application on this day, so we'll give you back to that date, because that's the day that WPS received your application. And some people say, hey, that's our retroactive enrollment date. It's really not, it's the starting of the process date for the application. This is different than professionals who can do things back for a certain number of days, but because that was not what I was asked, I'm not going to get super involved into that one unless you want that, but then you need to put that in the chat to tell me that you want it. So when you do not enroll, you must write the services off. So as the facility, if you are not enrolled with Medicare, you haven't started that process, you're going to have to write those services off. That is the last pre-submitted question that we have. So now I'm going to ask Aline to check my chat questions for me and see what I have.
Can you hear me okay?
I can. You're great.
Okay, thanks. I had some audio issues earlier. We have one question that came in early on when you were talking about the basics and what constitutes a Part A stay. And LaDonna asks, can lifetime reserve days be used after 100 days? And I did answer that in the chat, but I just wanted to clarify for anybody who might not have seen it, that lifetime reserve days are only for use by hospitals, not skilled nursing facilities. So I hope that helped. And then our question comes from Lynn here, and it says, do you have to have a SNF sign a contract before they reimburse you for services?
No, there's no requirement for that. The law doesn't state that you have to have a signed contract in place. The law says they're responsible for paying you. What's great about the signed contract is that you have some basic expectations on both sides then, and you know what to expect. On the other hand, their participation agreement, which is the same one that you signed, it's based in the Social Security Act. The participation agreement says that they agree to pay based on the Medicare rules, regulations, etc., just like yours does. And that participation agreement says they got to follow the rules. Well, what's one of the rules? Consolidated billing, or the bundling portion, is a rule. It's on the CMS website. It specifies all the procedures that need to be done. So while contracts are great and really do help with that effective communication and getting reimbursed, the way that you're expecting to, it is not a requirement. And I want to make that clear. It's not a requirement. If you've provided a service, we tell you the SNF is responsible, or you go through and you determine that, that is what you want to look at. Aline, anything to add to that?
No, Tom, you did a great job with that.
Okay, do we have any more questions?
One last question, and we might need a little bit more information here. Crystal asks, are you going to go over the new changes coming in July?
I would need some more clarification because I'm not sure which change. We know there are changes coming in July. Everybody, hopefully you're aware of that. Hopefully you're checking out the CMS website. You're keeping on top of that. Here's the thing. I'm not sure which changes you're referencing. So if you're talking about certain things, there are different things that can be done. So
We
I'm
just
not
got
sure
more.
what you're referencing.
Yeah, we just got more
Okay.
information. He says for the place of service billing.
Okay, I'm going to make an assumption here. So for those of you that don't know, this is a 1500 or A37P. The place of service is identified on that claim form. What it does is identify whether they are inpatient or outpatients. Are they in a Part A or a Part B stay? That type of thing, and there are different places of service. So what I'm going to do is I'll bring it up. Let's do a general search here. Let's see. Let's just, well, so first of all, if you're looking for place of service information, I would always start, and I will tell you, I know that this is not, Crystal, this is not what you're looking for, but I just want everyone to kind of be a little bit aware, for those of you that aren't familiar with this. The basic place of service information is in the regulations and guidance area. It's going to be in the manuals section, and it's going to be in the internet only manuals. If we scroll down, place of service is part of billing, so the claims processing manual right here. And I'm doing this as a two-part step. One, I want to see if it's even incorporated yet. But two, we're going to find the instructions for those. So remember I said it's a 1500 item. It's right here, chapter 26. Inside chapter 26, we can look it up and we can read through. And so what we want to do is find where it says place of service, which is right here, 10.5, not in here yet. Okay, so basically the new information hasn't been incorporated yet. We may not have all of that type of information, but what this does is lists all the different places of service. The current and existing information would tell us that for a skilled nursing facility, and I'm just scrolling down, what we're looking for is if they are in a Part A stay and you need to bill it to Medicare, you're looking for a 31 or a 32. And you guys see the difference between nursing facility 32 and skilled nursing facility? Skilled care, related care services, disabled for the sick or injured, healthcare. This is 32 used not for a Part A stay. 31 is for the Part A, 32. This is different than a custodial care, like just a regular nursing home. Like it's where they live, basically. That's what custodial care facility is. Because I'm not remembering the exact change, then you're going to have to look up the change. I will tell you that we are planning to do some more implementation on that change coming up. I don't know when that will be. I personally have not looked at that information, and that's why I'm not familiar with the exact change that's going on. I do know it's coming. I'm just not super familiar with it. And it'll be a place of service webinar, place of service information. So keep watching our calendar for that in our live events page. Other things you can do is type Medicare, place of service, change. And Crystal, again, I know I'm not answering your question. I'm just showing people how to find the information right now. Okay, so let's talk about the co-pair set, all the different things you need to be. If you want to know July 2025, maybe just helps a little bit more. And so it'll talk about some of the different things you might want to be aware of. Few key changes to Medicare place of service, mainly rural health clinic, which that's not what we're talking about here. Crystal, if you have information on that that you want us to specifically look at, I would recommend sending that in to us. And if you could do that, I'll do it via the follow-up, and then we can get back to you. That might be the easiest way, because I'm not familiar with the exact change. I know it is out there. I know I've read it, but again, it's not right in the top of my head. So I want to apologize for not being ready for that. But again, that's a great opportunity to send it as a pre-submitted question. We could have answered that for you, but I'm going to give you a way to get it to me as a follow-up question as well. Aline, any other type questions?
There are no other questions at this time.
Okay, well, let's go on. Couple of things to keep in mind. We will send you, or not we don't do this. Our system will send you an email. The email will come from WebEx. And what it's going to be is a certificate of achievement, but it's also going to be a follow-up email. It's just an automated email. And inside there, you're going to have a couple of key items you want to look at. One, it says provide feedback. That is your survey. It's going to give us what we need to know. It also has your certificate of achievement. If you need continuing education units, you need this certificate. Now, if you called in, I'll tell you how to get that in just a few moments, because that's going to be part of the same way to email us that question that Crystal's going to put together for me. Okay, so certificate of achievement, contact hours. Contact hours are what are issued to CEUs, but they're issued by governing bodies, not by us. So I don't have any way of knowing whether or not your governing body will issue you one CEU for one contact hour. I don't know that. Okay. The next slide talks about follow-up questions. This is where I need the question sent to. It does give you the email. Please make sure you put SNF CB Q&A in the subject line. This is not in quotes. That's why today's topic is not in quotes. It's to tell you, hey, use the topic from webinar title, whatever you want to do there. What we're looking for is to make sure that it comes to myself so I can get you the answer, or Lean, so we can work to get you that answer. It's not going to help if we never get you the answer. Couple of things to keep in mind with this. We do take those for 7 days. That includes a request if you dialed in for a certificate. You got 7 days to get that information to us. Okay? If you are doing the follow-up, just SNF Consolidated Billing, or SNF CB Q&A, great, put that in the subject line. Say, hey, I have a question I need some follow-up on. We'll get that out to you. If you need the certificate because you dialed in, then you must incorporate a phone number that is 10 digits. That means the area code and then the phone number. That's what we have to use to check our logs to make sure that you actually dialed in, which is a requirement from certain governing bodies before we can issue you any type of information. And so because we don't have your name and email address, which is why we automatically do it via email, we have to have your phone number, and it has to be the full phone number. All right. Please remember that if you're talking about a specific denied claim, I can't look those up. We don't have access to the system, so you will need to go back to customer service for that. Keep in mind, we would love for you to take our survey, give us our feedback, help us understand what you're looking for. A couple of ways I'm going to have this happen. First, I'm going to give a link in the chat. Well, I'm not going to do it. Aline's going to do that. That link will take you directly to the survey. Second, I showed you the email. In the email, you will have a link. Take it that way. Third, you're going to get a pop-up box when we leave. It's going to look like this bottom box. It'll say external site, little triangle, and it's going to give you a destination. Look for CMS Mac Fed ramp.gov. One, this indicates that it is CMS asking. The survey is not sponsored by WPS. It is sponsored by CMS. It is done on Qualtrics. That's the software. We're trying to get you to the Qualtrics area. So you can click continue. It'll take you out there. I need you also to consider taking it in the Encore if that's how you're listening. So we'll give you an online survey. It's going to look like this. You can click this. It'll open the link up and take you there too. The survey is very key and important. Here's why. We make changes based on the survey. The two key changes we've done right now are chapters to our YouTube channel and our training indicators. Now, the training indicators are still being worked in. We've published the page for them, but you'll see those entering into our descriptions and things like that on WebEx. Other things that we're looking at based on your survey feedback that are not on this slide. One, how can we improve the training center of our website? What can we do there? There's a variety of things that came up. We were like, okay. So we're looking at making changes to the live events and the encore pages. We continue to evaluate, and there are a variety of other comments, suggestions, and things that we're looking at. Those are the two that we have to focus on first. So I always want to hear what you have to say, but as that said, tell us what you want. Tell us what education you want. Tell us all of that. Give us anything you want in that survey. It's really helpful to us. That's it for me, y'all. Thanks for listening. We do appreciate your time. Again, I want to encourage you to please take that survey. Give us the good, the bad, the ugly, which is what I did well, what I could improve on, or what you felt like wasn't helpful. And the ugly is, was my PowerPoint good, and were the resources that I showed you good? So if you do that for me, that would be great. Remember, I really do need your topics, whether it's an education topic or an area on the website we can improve, just something. On behalf of myself, Aline, all of Provider Outreach Education, and WPS, thank you for your participation today. We look forward to your survey comments, and again, we hope that you'll join us for more education in the future. You may now disconnect. Thanks and have a great day.